Surgeons at Melbourne Vet Specialist Centre. I have a really interesting case today, which is a 4-year-old French Bulldog. You can see the orientation here, and this mass sitting right here is a big lipoma that is recurrent. And when we did the MRI, it extends all the way down to the skull alongside the ear canal. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. So the critical structure in this area is facial nerve. So there's definitely big potential that will damage that on our approach, and the owners have been warned about that. And facial nerve palsy in a brachycephalic is a more significant issue than it would be in a dolichocephalic dog because of the potential for exposure keratitis and corneal ulcers and stuff like that. So I'm making a vertical incision, and there already is a pre-existing surgical scar here. So I just put some Gelpy retractors in here. Hold on to those, please, for me. In Phoebe, I use electrocautery for nearly everything, and so it can kind of smell.
Yeah, that's what.
Not as bad as Cadaver Lab.
Exactly right. That's what I'm comparing it to right now.
Move that forward a little bit. So I have Phoebe here, who is one of my former receptionists who just finished her first year of vet school as a guest surgeon. If you have a second while you're watching, just let us know where you're watching from. We have one person from Egypt already. I don't think I've got a DeBakey in here. Can I get a DeBakey? Thank you. So Phoebe, DeBakeys are really delicate little cardiovascular thumb forceps,
Okay.
which I find really handy for delicate dissection.
Yeah.
So the first muscle we cut through here is the platysma. Thank you. It'll be interesting to see where this thing is attached as we get deeper in. We'll probably go through the parotid salivary gland because that'll be right in this area. What's that? Unfortunately, somebody's asking for spinal fractures and discs. Problem is that we don't have in-house imaging here that we would use for an IVDD, and we don't have on-site emergency center, and so I don't get those cases anymore like I used to. So I haven't done, where I used to do a few spines a week, I hardly do any anymore. Just note that on the YouTube channel, either VetAlign or VetDojo, there are a lot of spinal surgeries on there already, so you can certainly go back and watch the older content. So basically all I can stream are the cases that I see, so. All right, you can just set that down now. Come back in with another Gelpy. These are called Gelpy retractors, G-E-L-P-I. And I may have to convert this into a total ear canal ablation, depending on what we find as we get deeper in here. was kind of hoping that this would be a little bit easier dissection and that it would just shell out, but it's not to be. Hi Brazil, hi Canada, hi Tennessee. It's also hard to know exactly where the facial nerve is going to be in all of this. So that's a little better dissection plane there. Can I get maybe a sen? Thank you. And Phoebe, if you remind me if my head gets in the way.
Oh yeah, it is in the way right now.
Thank you. I do have a big surgeon's head.
Big brain.
Yeah. Big ego.
Yeah.
I think brains,
Gotta fit somewhere.
brains have nothing to do with it. To do surgery, you have to be as strong as an ox and twice as smart.
Can't seem to find any sharp ones. I've got some blunt ones. You really want some sharp ones?
Yeah, I probably will leave the blunt ones.
You what?
I won't take the blunt ones.
Alright.
If you can find them, if you can't, then I'll do without. So it's starting to release a little bit up here.
Slowly, slowly.
Thank you. I probably won't need them in the anal sacrorectomy anyway, so thank you. Okay, tug up on that. So it's getting into parotid salivary gland a little bit.
What happens if you go through it?
Parotid doesn't matter.
Yeah, doesn't matter?
Yeah. It's actually a lot of stuff that you'd think would be really vital,
Yeah,
and it's not.
not so bad. Yeah.
Just bring that back here. So that's the lipoma down there. So that's all the way down the midline. Stick your finger in there. You'll feel the sagittal crest of the skull. Go right down there.
Oh yeah.
Feel that?
Yeah. Wow.
It's cool when you study anatomy and then all of a sudden you
get
feel
to see
stuff
it.
and you're like,
I
yeah.
know that. Sagittal crest, that's an icon as well.
What's that?
I said the sagittal crest is an icon.
Yeah.
as well.
Alright, so I need to try to kind of get this stuff released. It might get you to retract on that. I'm going to get the zygomatic arch in the middle of this as well, which is going to kind of get in the way of my dissection. Let's release that. So is this your first surgery, Phoebe?
It is, yeah. On a live animal.
Yeah. Fun?
Yeah, love it.
We'll make a surgeon out of you yet.
What's that?
Make a surgeon out of you
Yeah.
yet. Might get another one and have you retract on that one back there. Yep. I really don't know how I would do this surgery without electrocautery in. I use cautery maybe more than some veterinary surgeons, probably not as much as human surgeons.
Yeah. Why is that?
Vets just are more timid with
Yeah.
electrocautery.
What do you prefer about it?
It's just so, like, much less bleeding.
Yeah.
You can just see so much better.
Yeah.
Go into that, please, for me. So if this was a big bloody mess, you just have no
Yeah.
hope of
Yeah, of course.
identifying the anatomy.
Yeah.
And all right, let's have another look here. Get this back here. Tug on that. So that's ear canal right there. So feel that with your finger. So that's, feel that hard. So that's the cartilage of the ear
Oh,
canal.
Yeah.
Okay. And that's parotid salivary gland right there.
Yeah.
Alright. That's parotid. That twitching, I think I'm getting close to facial nerve. So, pull back on that. Okay, we'll come up here. Might move this over here. You're feeling okay?
Yeah, feels good. Thank you.
Alright. Might release that. Kind of thinking on my feet here because it's not very obvious anatomy. At some point I may have to just cut into the tumor and then just kind of suction it out from the inside. And you don't really want to do that because then you're potentially contaminating the field with tumor cells. Certainly if this was anything other than a lipoma, you'd be really worried about
Yeah,
that.
right.
Okay, so that right there, feel that, that's zygomatic arch. So stick your finger right there.
Oh yeah.
Okay,
Yeah.
like that.
Getting in the way.
A little bit, I might be able to go dorsal to it. I still haven't seen the facial nerve yet. I just saw Morocco. So that's down to masseter muscle right there. So that's encouraging. And down to zygomatic arch right there. That's the zygomatic ligament. That's going to be globe pretty soon. So that's getting into the orbit there. Is it reacting to what I'm doing? See? So at the end of the zygomatic arch is where you have the stylomastoid foramen and the opening of the bulla, right? So feel right down there. So the zygomatic arch comes around like that, and then right to the opening of the bulla.
Yeah, right. Yeah.
Okay, so hold on to that.
Really get in there.
Yeah. And go ahead.
No, you go.
And this is an area that I go often because of total ear canal ablations.
Yeah.
So I'm just going to pull that masseter muscle forward now. So that's going through the parotid salivary gland right there. And then my facial nerve is going to be somewhere in this mess, but I think it's going to be pretty hard to preserve.
Yeah, right. Is all the twitching like facial nerve involvement?
No, not necessarily. It
Yeah.
could just be direct muscle
Yeah, right.
stimulation from the
Okay.
cautery.
Yeah.
Another funny comment.
No, I'm laughing at Timothy. She just assumed they were the correct area.
She's crazy. So, I reckon that's facial nerve right there. But I think it's going right into where we need to be.
Perfect. Oh yeah.
I don't know how, because it's going right.
Yeah.
Was this tumor causing the dog any problems?
So it's not causing the dog any problems other than facial distortion. The concern is that over time, as it grows, it would cause problems in the future. I don't know if that's facial nerve or not. But I mean, given where it's going, I don't think that it's salvageable anyway.
Yeah.
So is it possible this dog might not have a blink?
Very likely that it won't have a blink.
Doesn't look like we'll have to do the ear canal.
I don't think I'm going to have to do the ear canal, but I don't know yet for sure. Okay, so I've still got that up there that I have to get. So I'm sacrificing that, assuming that it is the facial nerve.
Yeah.
It's just going right into the middle. Just a hemostat. Don't need another one, it's all good. Thank you. What if I wanted one? Getting to the impatient stage of the surgery.
Yeah.
Getting a little squirt of blood from there. This is the point at which I want the other surgical team to come in and finish.
Keep out.
Yeah. All right, good luck. So you can really feel that zygomatic arch coming down back there.
Yeah. Yeah.
So just lift up on that for me, please. So that's
It's
the
traveling
ear.
all the way down.
Yeah. So that's ear canal there.
Yeah.
There's some big vessels down here as well. Getting there. So that's the neck of the ear canal right there. Okay, so it's starting to give itself up a little bit. A little bit of a hemorrhage in there. Can I please have some gel foam? The good stuff, the collagen. So this is purified bovine collagen.
Okay.
which directly stimulates the clotting pathway.
Yeah, right.
So it's much more expensive than just gel foam, but it
Yeah.
works much better as
And
well.
it's just like a little pack, is it?
Yeah. Okay, so that's out. All right, can I get suction turned on, please?
You want to send that to ice?
No, it's just fat.
No, so no sending off?
They're sending off.
Cool.
So the skull is just right there.
Yeah, wow.
Little bleeder right down there.
Someone said that they just joined. What was the invitation to remove this?
So it was a dog that had a progressively enlarging and recurrent infiltrative lipoma around the ear canal. And the concern was that over time it's going to get bigger and bigger and harder to remove, and it's only a 4-year-old dog. And I'm just trying to find any bleeders. Can we start on my next one, please? Or at least pre-med?
That would be Alfie, who is already cremated.
Okay.
Unfortunately, but not enough people to
Okay.
start.
No stress.
This is going to be me that's doing it.
Can I get some bupivacaine, or bupivacaine, please?
Okay, yep. I'll grab some.
Don't know if I'm going to need that.
Someone asked what was the signal.
So this is a 4-year-old French bulldog named Gina. Take that out. Thank you. Yep.
You don't like doing it that way, do you?
I usually use a. Oops.
That's
Hold
why
on.
you use it.
And over.
I'm more shaky that way.
Okay. Local anesthetic.
Oh, yeah.
And some 2O PDS, please. So, Phoebe, suture material can be absorbable or non-absorbable. So this is absorbable suture material.
Okay.
The definition depends on whether it's still around 6 months after surgery. And so
Right.
if it retains tensile strength more than 6 months after surgery, then it's considered non-absorbable.
Okay. Yeah.
If it's mostly gone by 6 months, it's considered absorbable.
Okay.
And then within absorbable sutures, you have some that last only 2 to 3 weeks, and you have some that last 4 to 8 weeks.
Okay.
So this is 4 to 8 weeks.
Yeah.
It's called PDS, polydioxanone, so it's the longest lasting absorbable suture material.
Right.
Hold on to that. And so I really,
Gives it time to heal.
yeah, I really like it because it
Yeah.
lasts a long time.
Yeah.
It's fairly non-reactive.
Yep.
It has good knot security.
Yep.
It doesn't have what's called memory. So memory, go ahead and hold on to that, means that it tries to maintain its loops after you pull it out of the pack,
Okay.
whereas this is nice and straight.
Yep.
So other suture materials are harder to tie because they retain their
Yeah.
loops. And what you're doing is called running the suture. So it's just kind of keeping the suture out of my way. Okay, grab some scissors. And when you cut my suture, you want to cut it about 4 millimeters in length. So go ahead and cut just about 4 millimeters. Yep. Yep, perfect.
You never even know.
That could be branch of the facial nerve, the palpebral branch of the facial nerve up there. That would be handy.
Yeah.
Seems a little bit too far dorsal, but
Frenchy anatomy is weird.
yeah. And then within either absorbable or non-absorbable suture
Yep.
materials, you have braided and monofilament.
Okay.
And so this is, go ahead and cut and give me 4 mils.
Yeah.
Yep. Yep. So this is monofilament. I prefer monofilament for a couple of reasons. One is that it's doesn't drag through the tissues as much, so this just kind of slides through.
Okay.
The other thing is that you could never use a braided suture in like the intestinal wall or something, because it would act like a candle wick and wick bacteria
Yep.
out of the intestine and into the abdomen. Another reason why I like PDS is because it's monofilament. It's kind of the perfect suture material.
Yeah.
So did you get into Charles Sturt as well?
Yeah.
Yeah, nice.
Yeah. I just applied for Charles, Sturt, Melbourne, and Murdoch.
Then you got in all three?
Yes.
Wow.
Yeah. Yeah, it was exciting. But Melbourne's came out so much later than everyone else.
Right.
So, Murdoch and Charles Sturt were a day apart. I was actually in Mexico when I found out.
Right. So smart.
Most of the, like, 'cause I was asking heaps of vets that were, and everyone was saying Murdoch.
Yeah.
That's the way to go. Yeah, it's been good though. Love that.
I've dropped that lysis dipped on the ground, and that can be re-sterilized. So ethylene oxide, because I never opened it. Faye, is Gina good enough to remove skin sutures, do you think? Awake?
Yeah.
Okay, thank you. And normally for skins you'd use something like nylon, which is a monofilament non-absorbable,
Okay.
but I've got PDS left over, and so I'll just
Yeah.
use it.
Good stuff.
Go ahead and cut that. And also so I don't have to, and both of them please,
Yeah.
up a little bit. So skin sutures you're going to cut longer.
Oh, yeah, there?
Yep.
Both
Yep.
sides?
And sutures cost about $12 a pack.
Wow.
And so if I can save money, I'm not going to be able to get away with it completely, but
Yeah.
certainly if you can,
Always try it.
yeah. Go ahead and cut that. Yeah. In fact, I know I'm going to have to. Fee? Fiona? Can I get a pack of 2O nylon, Ethlon?
Do you have 3 or 9?
I'll take 2O PDS then, please. Thank you.
We're going. But we're closed. We're closed. We're not got any imaging close, do we?
Nope. I wouldn't have any bandage on this.
Okay.
Thank you. And no NSAIDs,
Wednesday.
because it's a brachy.
Yep.
Just paracetamol, probably methadone overnight.
Yep.
And usually, because my hands shake a little bit, if I'm holding scissors or whatever, I'll have one in one hand and hold the other hand like this.
Okay, yeah.
This gives you a little bit of extra.
I get a bit shaky.
Yeah. I definitely do, particularly if I'm hypoglycemic.
Yeah. Oh, okay. I think mine's a coffee thing.
Yeah. How many coffees do you have a day?
I try to have one, but it's got 3 shots in it probably.
It's a strong one.
Yeah. I like them to be big,
Yeah.
so I can chip away at it.
Yeah.
Have a small one so I can have more.
Yeah, that's really smart. I need to start doing that because I do always end up getting another one.
I just drink decaf for the most part, yeah, because I shake too much.
And how message you didn't reply to me?
Oh yeah, I should see it. I don't really need the caffeine effect. I just like the taste.
Yeah.
The fluid rate.
It'll take you a little while to convert because you'll get headaches otherwise.
Yeah.
If you're used to having like
Yeah.
a big one a day.
I do notice when I don't have one, which is not good.
So they're almost done. Super. And you're okay? Like, everything's okay. We don't want to bandage on the top of that. Yep, just clean and that's it. And you can see you still someone else to help. Yes.
Jake and I have spoken about Polly after that. He's
Okay.
building a hole.
Okay. I'm ready.
All right, so just come over and make sure there aren't any questions I haven't answered. Hi Brazil, hi Taiwan, hi Vietnam. I was just in Vietnam last week. Hi Spain, hi Lima, Peru, Philippines, Morocco, Brazil, Canada, Tennessee, India, UK, and Egypt. All right, well, really great to see you guys again. And I probably will live stream something else this afternoon, so stay close to your phones. And if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time I live stream. And we will see you again soon.